So we're gonna do a video for you guys to understand draping. I want you to recognize that the table is pushed to the back. So when you set up your table, make sure that there's space for you to be able to get between your table and the end of your patient table so that you can drape all the way around if you're alone. I'm gonna take one of our drapes. So when you go to open up your drape, I want you to first unfold your drape. If you can see that the fold is in this direction, then you're holding your drape the correct way. Come to the edge of the drape on either side, holding it with 2 fingers, lots of space in front of you and around you to open it up. You can see the fold is away from me, and that's how you want to have your fold before you place it on your patient. You're going to take your hands and you have to tuck everything in, so that if I turn this way, you can't see any of my gloved hands. If I turn this way, you can see my gloved hands tucked in and protected by my sterile glove drape.
Good.
I always start with the top drape because you're going to have lots of space on your table for your drape. There's not going to be anywhere for it to fall. If you try and put the drape on the side first, it will often fall off to the ground, and that's not going to be very helpful. So come around your patient and place your first drape. Again, my fingers are staying tucked and hidden until I walk away. So before you come to get your second drape, make sure that you get yourself a couple of towel clamps. I will attach them on I'll put them on my ring finger in the palm so that they can be tucked away while I'm draping, but easily accessible when I need them. Take your drape. Again, you want this fold to be away from you, so if it's not away from you, turn your drape around. My fold is now away from me. Open it up. Tuck my fingers. And if you look at the inside, you can see that I have my towel clamps tucked inside. They're also protected and not going to touch anything unsterile. So next, you can put our drape on, attach a side drape next so that you have another drape that you can connect with. My hands can touch the top of these sterile drapes together. I can let go on this corner, and now while holding this, I can move my towel clamps and I'm ready to attach to my patient. So now it should stay where we need. Do the same thing. Have a couple of towel clamps ready. Get my next drape. Get the fold away from me. I can open it up, tuck my hands, and come around the bottom. Again, I have 2 sterile drapes that I can touch with my sterile gloves, and I can attach a towel. If you have a long patient who has a bigger opening on in their drape, you can place extra towel clamps in between to make sure that there's not any billowing, so we can put one in here if needed. Next, I'm going to come through my table, collect some more towel clamps. And my last drape to do my last side. With the fold away from me, open it up, hide my hands, and place it on my patient. Attaching your towel clamps. And if needed, you can add them in between any of your 4/4 towel clamps. One thing to recognize is that attaching your towel clamps close to the corners of your drapes will prevent a lot of billowing. If I attach my towel clamp way back here, you'll get a lot of billowing of your drape underneath, and hair and things can come up underneath that area. So try to avoid that. So our last drape is going to be our top drape. So this is something that's going to be easiest to do with a partner, but can be done by yourself. If you look at the drape itself, look for the long dimension, which tells you it goes this way. I will take this and put the spine of my drape on the center where I intend to make my incision. And then when it opens up, you should be able to open it appropriately on your patient. First, you should take this side. Never let your hands go below the table, so you have to drop it from here. If you don't have an assistant, you have to sort of hold on to the center and then do the same thing across the table. And then as you open up cranial and caudal, your hands need to make sure that they're protected. So I'll grab this corner, tuck my hand in. So on your side, you should not be able to see my gloved hand. I'm going to hold on to the main drape on my center of my patient so I don't pull it away from me. And then I'm going to advance it over the end of anesthesia. And then I'll do the same thing on the opposite direction and hide my hand under here and advance it to the end of the table. So anytime that you're aiming for a dirty area, so an area that does not have sterile coverings, you need to make sure you protect your hands and keep them covered when you are sterile. So if you have an assistant to help you place your top drape, you can either have a sterile assistant or a non-sterile assistant. This first demonstration is going to be a non-sterile assistant, so I'm still going to place my drape with the center on my planned incision. I'm going to open it up, and then I have to still throw this kind of off the end of the table towards my non-sterile assistant because they can't come and touch any of the stuff on top of your patient. So it's going to go off the table to them, off the table to me, and your non-sterile assistant can only touch things that are below the level of the table, and as the sterile surgeon, your hands need to stay on top of the table. So still protecting your hand, they can help from their side to bring it forward. Protecting your hand is going to help from the other side to bring it forward. So a little bit easier with an assistant. So another option is to put your top drape on with another sterile assistant. So one person will, again, put the middle of the spine of your drape onto your patient and open it up. And now both sterile assistants can open the drape, again, opening it wide and dropping it. And then both of us at the same time can open our drape cranial and caudal, but again, we need to hold onto the drape so it doesn't move. And both of our hands, because we're sterile, need to stay on top of the patient, and it cannot go below the table. So we will hide our hand. Hide our hand. So next, obviously we can't see our patient yet. We need to cut a hole in our top drape. You need to find your bandage scissors. These are the only appropriate scissors to use on your drape. And then usually I'll just feel for the corners to find out where the kind of cranial and caudal extent of my towel clamps are. And start by making a cut on one end. You have an idea of where your opening is. And make it similar in size to your draped section. This paper is technically still sterile, so you can put it either into a garbage bin on your table, or it can go off into a non-sterile area. So to secure your top drape to your 4/4 drapes, you have two non-penetrating Edna towel clamps. Put one on either corner, and you can either put them around your towel clamps underneath or just directly to the drape itself. And now this will hold your top drape in position for your procedure. So after your patient has been fully draped and you've created a sterile field, you can now attach your sterile light handle. If you look at the light right now, there is no light handle on there, and unfortunately our light is not on. However, we can now take our sterile light handle cover, attach this above, and the bottom acts as a button. I can turn my own light on, and I can lower and move my light to center it directly over my patient. The button itself also will allow you to adjust the level of light that you have on your patient so that you can turn it really bright or less bright depending on what you need. Finally, now that our patient is set, We have our light organized where we need it. We can pull our table in, and you should always pull your table in so that it's directly over your sterile surface. My hands have to stay on top of my table, and I'm going to pull it directly in to my patient. I can easily reach where I need my instruments and perform my surgery without having to walk away from my patient. For the purposes of this demonstration, I want you to think of the tape lines as your clipped margins of your patient. Whenever you put drapes on a patient, you should always drape your patient as wide as you clip your patient, because there's a purpose to your clipping, is to make sure that you are safe in your surgery. So with your drape, as usual, you're going to open it up, fold away from yourself, hide my hands. If I'm going to come for the front drape, my goal is to aim for where I want to drape the patient. So I'm going to come over the patient, and I'm going to land at the location that I want to drape. I'm sterile, so I can make sure that this stays where I want it to be. So I'm happy. My next one, I'm going to demonstrate if you place it somewhere that's too far past where you want to drape, and you need to give yourself more space. So if I am ready to drape my patient and I want to aim for my tape line again, but unfortunately I aim too far, that's okay. I can slowly bring my drape back to the level at which I'm comfortable where I would like to drape. I cannot, unfortunately, if I pull this drape back further and now I see fur, this drape is no good and has to be discarded. Ideally, we're going to do one more, and I'm just going to show you, you have the control over where you would like to place your drape. So don't aim for too far. Aim for what you're truly wanting to drape, and you can place it directly over that location. You should be able to land very close to your proposed draping position. If you feel like it's just a little bit too far, you can always back it up, but you can never move it forward towards your sterile field. So for your towel clamp, you're going to hold down the drapes in the corner, open up nice and wide, and take a bite. If you don't grab on the first go and you're still underneath your drapes, you can readjust and open up your clamp and try and take another bite and still use this towel clamp. If you don't grab your tissue and you pull your towel clamp back through your drapes, then this towel clamp needs to now go off into a non-sterile field, and you have to get a new towel clamp to be able to attach your drapes to your patient.